Now, our first guest on the show today is a remarkable humanitarian leader whose work is transforming lives across Africa and beyond. I'm talking about Lady Mary Dinah, who is the founder and CEO of the Mary Dinah Foundation, as well as a global partner of the Maternal and Newborn Fund. She's a visionary philanthropist known for her groundbreaking work in maternal and child health, as well as women's empowerment, reaching millions across Nigeria, Cameroon, Chad, and Sudan. Now, she is setting new standards in social transformation and humanitarian excellence. Thank you so much for coming to the show. I appreciate you. And I think first, I have to say congratulations on the Forbes cover. It's not easy. So it's not an easy feat, appearing on there. But I think the first question I have for you today really is as regards your journey and your vision. You've built one of Africa's, let's say, a very impactful organization, as it were. What first inspired you to dedicate your life to service and social transformation?
Yeah, thank you so much, first of all, for having me. The foundation started in 2005, so that's 20 years ago. I was straight out of school in the UK in London, and I just had the passion to help women initially, and then women and children. And there was an area of East London called Shoreditch, a road, quite notorious road called Brick Lane, and there were a lot of women there in homelessness, and many of them were on addiction. And that was how I started supporting the women, connecting them to accommodation, connecting them to rehabilitation as well. From there, I then came back to Nigeria and set up JobLink, based in Ikoyi, which is one of Nigeria's first ever physical job centers. We partnered with Microsoft Philanthropy, and then we worked with Lagos State government, and then we started school feeding, and then we connected with USAID. And with their support, we're able to go from 100,000 meals a year to 5 million meals a year. So that was a big expansion 5 years ago in 2020. Now we're distributing over 15 million meals every year across conflict regions to women affected by terrorism and war in the northeast of Nigeria, far north Cameroon, Chad, and the borders of Sudan.
Okay, so you often speak about compassion as a leadership principle, but in today's Africa, I don't know, doesn't that look like a joke? What does compassion leadership feel or look like? Because you look in Africa, and some leaders that, should I say, have been in seat of power for decades, and even how they probably govern their people. Do you think compassion and leadership, or compassionate leadership in Africa should, go hand in hand?
I think it's very important, especially in Africa. Yeah. You know, we're dealing with a continent that has a number of countries that are still developing, number of countries that are within the global south, what we call the global south. And it's not only sort of strategy or the normal kind of vision as a leader or financial knowledge or economic prowess. We have to have compassion for one another. And that is the only way that we're going to make it as humanity, how much more as a government that's supposed to be supporting its people.
I mean, speaking on your personal drive, you've worked across hospitality, global business, and humanitarian sectors. What shaped your passion for helping vulnerable women and children?
Yeah, I mean, when I think about my years as a hotelier, that's my profession. I have a master's in hotel management, and I worked with international 5-star hotel groups. We were focused on fine dining, always in the service industry, welcoming people to the hotel. And it was just a light bulb moment when I thought, what if I can take this passion for people, for service, for anticipating the guest needs, and what if I can do it where it really matters? And that's how I made the connection between hospitality and humanitarian work. But I tell my team, we employ over 200 people, and I tell them, even if we're in a refugee camp distributing food, these people are VVIP. We are working for them. We are serving them. We're here because of them. And that goes back to the compassionate leadership that we're talking about. It's about serving people.
All right, talking about serving people and your Zero Hunger program. Can you walk us through it, how you began and where it is today?
Yeah, so the Zero Hunger program is a flagship program. It was designed together with USAID, and the idea is to focus on people who are the most vulnerable in society. So when the pandemic hit, I was looking for ways to help and to support other people. And we connected with them, and I decided that the refugee camps and the IDP camps around the world is by far the area of greatest need, especially in the case of during a pandemic. The people had really had nothing, and we wanted to help them. with USAID, they had done a lot of research into pregnant and breastfeeding women and the needs of that particular population segment, and then also babies under 24 months. And that's how we, came up with the strategy for the Zero Hunger program. Of course, it aligns with the UN SDG 2, which is Zero Hunger, and it aligns directly about supporting people. Preventing malnutrition is the main objective between pregnant and lactating women and babies. So we distribute blanket supplementary food. It could be rice, it could be beans, usually fortified with vitamins, and then multiple micronutrient supplements or food supplements that are essential for babies. Because as we know, a baby under 2 is not really eating full solid like rice yet, but these micronutrient supplements, it's more like a peanut butter paste that is fortified with all the vitamins that a child needs to prevent malnutrition. And these areas have some of the highest rates of malnutrition. A lot of the children there are already experiencing severe acute malnutrition or moderate acute malnutrition. So we're preventing it rather than treating. I think it's important for us to focus on prevention rather than treatment, because if we're treating malnutrition, it's already too late.
Fantastic. Well, we talk about, over 55 million specialized meals, 10,000 women, connected to maternal care, like you just said. Those in itself are staggering numbers. What has been the biggest challenge and triumphs that you've faced along the way?
Well, the biggest triumph is being able to target and reach these women and babies. They're in very hard to reach regions. These are areas that access to it is in itself an issue. During the rainy season, especially in the far north of Nigeria, northeast, but then also Cameroon as well, just across the border of Borno and Yobe, you have an area called Mokolo, and the refugee camp we're operating, there are actually 65,000 Nigerian refugees who fled the conflict in the northeast. Trying to get our trucks across the border is a huge challenge. During the rainy season, we literally have to park the trucks with the food and wait for the sun to dry the water for the water to go down. Those are the kind of terrains that we're operating in. And you can imagine the security risks with that. So it's huge challenges, security challenges, logistics challenges. Trucking the food from places like Lagos all the way to the northeast takes about 7 days by road. So it's a huge logistical feat, but it's worth it. I always say that the hardest people to reach are the most important to reach.
All right, so before I wrap things up, I like the fact that you brought in Lagos. Now, you were recently appointed Special Envoy on child protection by Lagos State Government. Now, how have you been able to use that position to sort of make a change? And I'll bring it to maybe around here on the island. There's a lot of kids begging in traffic. I think it's now a pandemic of some sort. You can't drive past Lekki, or not just Lekki, even around Lagos. Let me put Lagos. You can't drive around Lagos and not be, should I say, flanked by kids begging. And sometimes they even go as far as even being violent. So what are you doing using your position to actually bring that change?
Yeah, so we work very closely with the Commissioner of Youth and Social Development, Honorable Bolaji Ogunlade, and together my focus is more the orphanages. And one of the first things I did was I visited, all of the key orphanages in Lagos State. The children who have no home, nowhere to go to. Some of them babies, some of them are found on the road and then taken to the orphanages. In terms of the children on the road,
streets, yes.
Streets,
it's becoming a serious issue.
I know the Lagos State is working very hard on that to relocate those children. We've been working with some of the hostels, accommodations that they've built, to house them, and we're also working on the bridge between when some of them leave the orphanages and the government homes, in between before they go to university. So that is kind of
like a transition phase.
It's a transition phase because they tend to leave the orphanages at the age of 15 and then they start university at 18. Those 3 years where they're maybe older and difficult for them to be adopted, but before they're fully independent, it's quite challenging. And we're working on creating and building new houses, renovating them to get them off the streets and make sure that we connect them to gainful employment and make sure that they're useful and valuable in their society.
So what's next for, I know that you obviously have your hands full, but what's next for you? What's next for the Mary Dinah Foundation? And, for you personally, as you continue to scale your impact across Africa and beyond?
Yeah, thank you so much. So it's 20 years now. Yeah. We've had a lot of impact when we see in terms of our results, what we've been able to achieve in the Northeast, for example. when we entered those communities in the northeast of Nigeria, about 80% of the women were delivering their babies at home with a grandmother or an auntie that kind of helps all the people in the community. As we know, West Africa and the Sahel region has one of the highest rates of maternal mortality. It's very dangerous to have a baby without a skilled practitioner. Now, in those communities we're in, the number of women giving birth in hospitals versus at home is about 89%. Huge change, major life-saving impact. So we're pleased with what we've done, but it's definitely a drop in the water. It's not enough. We want to do more. Our goal now is to focus on mothers in refugee camps around the world. And we have a 20-year goal to impact 200 million refugee mothers. And that's our big agenda. And, I'm very inspired by Bill Gates. He's sort of closing down the Gates Foundation in 20 years. They're going to spend down about over 200 billion in 20 years. And the idea is that, focusing on legacy is kind of an ego project where you say, I'm going to give the money to my children and, they would continue. Who knows what they're going to do when you're not here? And he's focused on doing the most that he can with the time that he has. I'm inspired by that, and that's the same objective behind 200 refugee mothers over the next 20 years.
Oh, thank you so much for that, and thank you so much for coming on the show. We do wish you the very best with all the fantastic work that you're doing, and congratulations once more on the Fox.